All right, we'll go ahead and get started. I want to welcome everyone to the LeadingAge Texas weekly COVID-19 provider call. We thank you all for joining us. Another reminder, please keep yourself muted and unmute yourself when you'd like to ask questions or use the chat box at the bottom of the screen. We do encourage you guys to use this as a forum to ask questions throughout. So I would like to first begin by introducing Adam Grafton. He's with Morrison Living, who is a LeadingAge Texas Platinum sponsor. So we welcome you. Adam brings over 19 years of culinary experience to the senior living space, where he continues to push the limits on food experiences, executing on trends, enhanced design and innovation with the main goal of delivering on a memorable experience while staying ahead of the shift in customers. Adam is known for his culinary excellence and execution, as well as the training and development of executive chefs, regional chefs, and corporate executive chefs, which he believes translates into consistency in culinary leaders that deliver at a high level every day for residents, guests, and clients. Adam, thank you for joining us today. And when you're ready, please share your screen and begin.
Excellent. I'm going to attempt to share the screen. Okay. How's that? Good? All right,
Yes.
Can you see my screen? Okay, great. I just wanted to make sure.
Absolutely.
Awesome. Well, gosh, I didn't realize my bio was that long, so I apologize for that. But hey, just to start out, just want to extend my thanks to everyone on this call who are leaders of frontline associates, as we recognize our nurses, caregivers, plant operations, food service workers, of course, dietitians, and administrators who are on the front line making a difference through these challenging times. I appreciate the opportunity to be here today and want to take some time with LeadingAge members, of course, to simply share my experiences of COVID-19 from a Morrison Living, culinary and operations perspective. As you can see on the screen, my theme is making lemonade. So handed lemons essentially overnight with COVID-19, and making lemonade, of course, is my opinion that best describes COVID-19 situation, as I'm sure everyone would agree. And of course, wearing proper PPEs, which seems to be the new fashion. So here we are. Let's go back briefly in time prior to COVID-19, and I want to paint the picture from a Morrison Living operations culinary perspective, as I'm certain that many of these fundamentals, practices, and goals were in place in your communities. Think about, you probably were preparing for menus as it relates to spring and summer, planning Easter, Passover celebrations, which probably included that big holiday brunch with large groups, family members coming to visit mom and dad, perhaps teaching kitchens with activities, and residents preparing for state surveys, developing new theme meals and marketing promotions for your community, working through design, building or planning new dining venues, group marketing events with the focus of filling census and selling apartments, organizing plans to attend upcoming LeadingAge events, creating new training programs, searching for that right point of sale, perhaps that point of sale system. The list could go on and on with objectives and goals that we all had to improve the engagement, the overall experience in our communities for our guests and residents. And here's the start of our new journey, full of unknowns, challenges, concerns, fears, and simply adjusting to our new norm with the number one focus of still providing the best care for our residents. At the same time, our concerns around our frontline associates, which there are heroes for sure, have been elevated. Much has changed from an operations, CMS, CDC guideline standpoint. Our frontline heroes are amazing and truly show the passion, caring nature, and frankly, their love for our residents through the work they do each and every day. So here's our lemons. From an operation, quality assurance standpoint, just wanted to expand on several of these key changes to our senior living model, as all of us have been dealt these lemons. I just want to briefly touch on what are some of these lemons that we were dealt with. So communal dining shifted to room service and takeout. Lack of socialization. You think of friends and families entering the community activities, communal tables, engagement, interaction, very limited. That was very concerning for all of us on the call. Activity levels are down. We noted that. Also, we looked at the concern of weight loss for sure. Independent living, the new service model, what have we seen there? Well, dining rooms are closed. It's becoming takeout. It's becoming room service. It's becoming that whole delivery model. Technology, a big one. Understanding the need for technology to communicate with our residents and family members during this crisis. Questioning, did we invest enough into our IT solutions in our communities? Do we have the right technology? Also, the simple notion that our residents are quickly learning how to use FaceTime, Zoom, email to see and communicate with their loved ones. PPEs, simply how do we get our hands on the face masks, the shields, the gowns, the sanitizers, and would we stock PPEs differently if we were able to rewind the clock? Menu development, definitely. When we look at menu development, emergency menus or not, meaning, when this happened, did we jump right into our emergency menu, our emergency supplies, or should we just modify menus? And how do we adapt to room service and takeout was a big one. Procurement, very important. So supply chain, what does that look like? How can we think ahead and prepare ourselves? What if we had to purchase meals tomorrow because we have staff members in the kitchen or cooks perhaps that need to be in isolation? So procurement was big. Definitely disposables was a concern. How do we go ahead and source and assure that we can keep the purchasing going, and how long does that last? Emergency supplies, definitely, from a 3-day, 4-day emergency supply, was that enough? How do we, what does that look like in the future? Is it 7 days? Is it 14 days? And also with menu development, it was how do we adjust our menus to meet the current demand in the communities, such as the amount of meals that are going to the rooms? How do we produce our normal sort of menu with 12, 24 options? Obviously, we need to adjust our menus accordingly. And so, as we look at all of those sorts of lemons that we were dealt, and some of those challenges, it's really important, as I'm sure everybody would agree on the call, is how do we turn those lemons into lemonade? What are sort of those best practices? How have we been listening to our team members in our communities and seeing all the great best practices that everybody's been doing, and translate that into concepts, programs that are going to make a difference in our communities with what's changed and what's our new norm. So, we look at takeout and room service experience. How can we enhance that? Some of the things that we've been doing in our communities is obviously getting creative with the packaging, still trying to elevate that experience. Doorknob hospitality cards, just messages on doorknob cards that make the residents and assure our residents that we're thinking of them and we care and we love them. So that's just the little things that go into a takeout room service model that's much different than what we've had in the past. Online grocery and pop-up markets. So we definitely saw the need, as I mentioned earlier, about the independent living model changing, and even associates that they don't have time to go to the grocery store. They're working long hours. How can we provide sort of that online grocery list of items, as well as pop-up markets in the communities? Our cafes are limited access, some are closed. So how can we use some of those dining venues to create that pop-up market for residents as well as associates to purchase groceries? Themed meal room service. So we saw this as a really cool experience for our residents. So it was really looking at how can we create some theme meals. So Chinese takeout was one that we did. So how can we theme that room service meal, the menu, and offer fortune cookies and chopsticks, for example, just to break up the monotony. 10-2 Time to Groove. Just listening to our team members in our communities. Earlier, I mentioned the concern of lack of activity, concerned about weight loss. And essentially what we've done, a great best practice, and I'd want everybody to kind of take a look at that in your communities, but creating that 10 o'clock and 2 o'clock time frame during the day where there's a mobile cart that's being pushed down the hallways, and there's snacks and beverages available, and residents get the opportunity to not only participate in the snacks and the beverages, which would be some healthy snacks and smoothies, sort of that high calorie offering, but also at the same time, there's some activities where residents can open their doors, stretch, some music to the theme and the exercise. So I thought that was a great best practice from listening to the teams out there. We definitely took a look at building our provisions guide, and what I mean by that is what are all those sorts of resources out there that would offer, if need be, offer those complete retherm style meals, fresh meals, grab and go options, to not only take some of the burden off the back of the house team members and the departments, but also if there was a need to turn around and have meals produced outside into the community from a push of a button, it's there for us. Cell phone apps for internal staff coverage. So we've seen communities create an app, especially on the Morrison Living side, just having communities that are close by that can share frontline associates, even from different departments, but sharing what sort of those open positions are, and folks being able to fill those positions and cover some of those shifts. 21-day room service menu. Earlier, I had mentioned, how we went ahead and looked at room service and takeout and looked at our existing menus. And one of the things that we did was really just create a 21-day room service menu that's functional, easy to execute, but still focuses on quality. And our operational resource guide, looking at that COVID-19 sort of resource handbook that's been created over the past 3 or 4 weeks, and developing that into a solid guide that's being able to being shared with all of our team members. It's kind of been our one-stop shop for everything COVID-19, and we continue to grow that. Obviously, as things change, we continue to grow that resource guide for all of our operation team. And then looking forward. So looking forward, it's all about the discovery stage and kind of where we're at right now. How we plan to reopen our dining rooms is the first component of this plan from an operations and sanitation standpoint. Then what does the new norm look like for senior living? And I'm sure many of you on this call with your teams as well have been kind of thinking about what that new norm is going to look like, and how do we go about opening up all of our dining venues that have been closed for quite some time. So, I just want to kind of shed some light on some points here around our operations, and perhaps what that would look like in our new norm. Remember the lobby outside your dining rooms at 4:30 as residents are lined up in a crowd to enter the dining room. What will that look like? Reservations, perhaps. Preset silverware, glassware, condiments at the table, or forgot about that menu jacket. So what does that look like? Everybody's using menu jackets, so is there a process and procedure in place for sanitizing all the menus, or are our teams now being trained to really speak the menu? Salad bars, fountain beverages, loose silverware, what will that look like? Self-serve buffets and catering, what will that look like? Retraining our servers in our dining rooms since they've been in that delivery mode, what will that look like? Emergency supplies, is it 4 days? Is it 7 days? Is it 14 days? What will that look like? PPEs, what will that look like? I'm sure many of you on the call are thinking about PPEs and how do we store those for, let's hope it doesn't, we don't experience anything like this again, but if we do, are we prepared? Looking forward is all about planning, communicating, establishing new standard operating procedures, training, executing these changes, which will become our new norm in senior living. So I thought it was important just to kind of paint the picture of what senior living perhaps is going to look like in the future. And that's everything I wanted to share. I'll go ahead and go back, switch to the main screen so I can look at any questions that come up in the chat.
Thank you, Adam.
Awesome.
Let's see. Does anyone have any questions? I don't see anything in the chat.
No questions, huh?
No questions. Please. Currently. We had talked a little bit prior to this, Adam. I know there were questions about disposables, using disposables for the in-room dining. Any best practices on that, or what? Any suggestion at all?
Yeah. So a couple things. What we've experienced was, and one of the things that we needed to do was right out of the gate, as soon as the new CMS guidelines came out, it was, let's inventory what we have from a China standpoint. Let's just face it, we've never really looked at our operation and established a large enough inventory to go ahead and China service from a delivery standpoint in everybody's room. So that's the first thing. So it was inventory. Let's see if we have the capabilities of doing China service for all room deliveries. In most cases, the answer was, well, no, we need to move to disposables. So then it became, let's establish what that core standard is going to be from an operations standpoint of the disposable items, so that we're really standardizing that, and we're standardizing it based on what sort of supply chain inventory is out there, so that we're not necessarily guaranteeing that we have all of those disposables, but it's the most sort of line of disposables that are available to us. So we had to really standardize what those disposables are as an organization, and then make sure the field understands what that standard is, so that we're maximizing sort of those inventory SKUs in the warehouse. Hopefully that helps.
Yeah. Thank you for that. Any other questions from or for Adam? Well, I thank you again for joining us. You're welcome to stay on the line.
Sure.
We appreciate it.
Yeah, no,
Next
thanks
we'll
for
move.
having me.
Yeah, for sure. Next we'll move on to Elise Meyer on our regulatory update.
Thank you, Crystal. Hi, everyone. Hope you're doing well. Gonna walk through some recent regulatory updates and give you some inside scoop on discussion regarding Medicaid increases and some other advocacy efforts we're participating in. First, many of you should be, are aware of the new CDC reporting requirements coming out of CMS, as well as reporting requirements to family and residents. CMS and CDC will provide nursing homes with specific directions on this, and rulemaking will follow, but there will be reporting requirements for facilities to notify both the CDC as well as residents and family under certain circumstances within 12 hours of an occurrence of a single confirmed case or 3 or more residents or staff with new onset of respiratory symptoms that occur within 72 hours. And weekly updates will also be required, or an update when each subsequent confirmed infection occurs. We will be sure to get this detailed guidance out to facilities as it's released, and happy to answer any initial questions around this today, but stay tuned for more guidance on implementation. We, as LeadingAge Texas, participate in a healthcare strike force along with several other healthcare related associations like Texas Medical Association, Nurses Association, the Hospital Association, and so on. That allows us an opportunity to talk directly with representatives from the governor's office, as well as Dr. John Zerwas, who is leading the supply chain strike force for the governor, and Dr. John Hellerstadt of DSHS. This last Saturday, we had long discussion regarding prioritizing long-term care facilities for rapid testing as well as PPE. There was consensus that long-term care facilities need to be prioritized, and we're actively working on a strategy to do that as Texas's PPE supply and testing supply grow almost daily. We also submitted a joint letter with the Texas Healthcare Association and Assisted Living Association encouraging this prioritization by DSHS and the governor's office for testing and PPE. That was sent last night and is available on our coronavirus webpage. We're also talking to several elected officials to participate in our advocacy efforts and help us move the ball on getting priority for both PPE and testing, as based on reporting, it sounds like the state is anticipating some major increases in both of those within the next couple of weeks. So that was optimistic, but we're continuing to work hard to get our members and all long-term care providers prioritized. Last week, there was an update provided to me. This is not public, but HHSC submitted a Medicaid increase request to the Legislative Budget Board. There weren't many details offered around what this looks like, but the focus of this increase will be on increasing direct care wages, covering the increased costs providers are experiencing on PPE, as well as dietary related expenditures. So we hope that that request is approved by the LBB soon, and we'll be sure to update our members on any formal notifications regarding Medicaid rate increases. To stick to Medicaid for 1 second, I just want to remind all eligible nursing facilities that tomorrow is the deadline to apply to participate in QUIP Year 4. So please make sure your applications are in and complete. There was several questions that came in last week regarding Medicaid eligibility of residents or people you serve due to them receiving stimulus checks. We reached out to HHSC and they are on this. They do not see any issues with eligibility when these stimulus checks are received. So we should not see any issues in recipients being kicked off Medicaid because of this additional income. Of course, keep us posted if for some reason there is an issue, but HHSC has assured us that for now this should not be an issue, and they're actively working to make sure it is not. Also, HHSC has recently implemented and provided guidance to cover remote delivery of physical therapy, OT, speech therapy for Medicaid recipients. MCOs have received guidance on providing this service through video, audio, visual, telehealth. So for those of you serving Medicaid residents, you may be seeing more MCOs providing this service, or more of these therapy services being provided through means of telehealth. If you see any issues there, please keep me in the loop as things progress. I also just wanted to mention that with regard to affordable housing related resources, please be sure to stay up to date on LeadingAge's national website. They are consistently adding affordable housing related resources related to COVID. So I just want to draw you affordable housing providers to the LeadingAge website. You're always free to reach out to me directly, and I'm happy to field any HUD related issues you may be having to national staff, but want to refer affordable housing members to the LeadingAge website for those types of updates. And just a couple notes on housekeeping related items. The webinar recordings of the nursing facility and assisted living facility webinars that HHSC is hosting are now posted to the resource page, and I believe the registration link is also live for both of those calls scheduled for Thursday and Friday this week. As I go down my list, I think those are all of the items I wanted to highlight, and I will hand it off to Corey McDonald, who should be on the line for a couple additional updates.
Thanks, Elise. Yeah, I just wanted to touch on primarily one item, which is the terms and conditions that the Health and Human Services has asked providers to sign and return. Basically, it's an attestation statement, and it is in regard to the relief money that was sent out and basically directly deposited based on amount of Medicare that each provider provides. And in conjunction with that, the HHSC sent out some terms and conditions that people, like I said, are supposed to sign and return. And I first want to note that this is not due until 30 days after, basically after it went out, which according to calculations I've seen is makes it due May 10th. And I also want to note that LeadingAge National is advising to hold off on signing this until they get some more clarification about how it will basically apply, and some inconsistencies that they've noted between the language in the attestation statement and the actual underlying act or guidance about the act that funded it. That being said, so first off, I would recommend, following that LeadingAge national guidance and waiting. There's no need to rush and get it back if you have 30 days. So might as well wait and get a little more clarity on it. Some of the areas that I would anticipate the clarity would be desired for is, for example, the third bullet in the terms and conditions says that the recipient certifies the payment will only be used to prevent, prepare for, and respond to coronavirus, and shall reimburse the recipient only for healthcare related expenses or lost revenues that are attributable to coronavirus. So, I think that's good that it mentions lost revenues attributable to coronavirus. So it's not just about expenditures that you may have extra expenditures. I'm sure many folks have that as well. But the fact that it is open to lost revenues, I think is helpful. But again, what will you have to show for any of this moving forward? Because another bullet is, it says that they'll basically be reporting within 10 days after the end of each calendar quarter, and the report will contain the amount received, the amount of funds expended or obligated for each project or activity, a detailed list of project or activities, information about employees retained or jobs created. So, one item of waiting to sign would be to hopefully get a little more clarity about, what you have to turn in moving forward. And another, and also basically getting as much clarity as possible about what you can spend it on. That being said, I do like, again, that they put in lost revenues, because I would assume that most folks are experiencing, lost revenues of some kind. It does say in these terms and conditions that the recipient has to certify it will not use the payment to reimburse expenses or losses that have been reimbursed from other sources, or that other sources are obligated to reimburse. That's another one I would like to get some guidance on. Certainly, one example would be if you happen to have insurance coverage that paid for lost profits. I doubt there's many policies that are, insurance companies that are chiming in to give you money right now about that. So that's probably not likely, but again, just hoping to get some more clarification on, what the ongoing obligations are. If you can afford to, I would probably keep this money sort of in reserve until we get a little more clarity, but certainly, the way things have gone so far, the idea seems to be to just get the money out there. And if you have a pressing need, obviously trying to document, what you use it for. And also if you have an accountant or a consultant that assists with those sort of issues, to talk to them about how to best document use of these funds, how best to show that you've used them for what the appropriate things are to use them for, as we still figure out what those are. So obviously, one other item of this that I want to point out is that hospital districts, for those nursing facilities participating in QUIP, you may have gotten a request from the hospital district that holds your facility's license, asking you to essentially take on all the obligations, or to essentially attest to all the same things that they're being asked to attest to, because they're the ones that are going to receive these terms and conditions. They're the ones that are going to receive the money. Hopefully, they're going to just push that money over to you, because it's for you and your facility. But but just being prepared for the hospital district to come to you and say, okay, well, we're being asked to attest to these things. We want you to actually attest to us to all the same things. So let's keep an eye on this and keep trying to figure out as much clarity as we can about what you have to do with this money or how you can use it. Elise, I'm happy to answer any questions or talk about any other items. I can't hear you.
Corey, there's a couple questions that have come through. We received the HHS Medicare money, but not the attestation form. Where and from, who does it come from? And who does it come from? Yeah.
That's a good question in terms of where, I haven't been a recipient of one directly. I've just seen them forwarded to me. So I don't know what channel or what, if it was sent by email. I do know that if you go to the HHSC CARES Act Provider Relief Fund, there's a link to the form there. So I'm working on 2 different computers here, but I can type that in after I stop talking so that you can see the form there.
Okay.
They actually have a portal where you can basically do the attestation. So I'm thinking that they there's both a link to the terms and conditions and a portal to submit it. So, if they haven't sent it to you, I would look closely to see if it came in. I don't think anybody's gonna get out of it by them not having sent it. So if you didn't receive it, I would go ahead and look on that portal as the next step, or on that website and look at the links to the terms and conditions, which, like I said, I'll plug in here in just a minute.
Okay.
Is there any other questions? I'm not seeing any other ones about that topic.
No, not about that topic. There is one about funding available for communities with IL residents from the administration for community living under the CARES Act. Is that something you could talk
I'm not
on?
familiar. If that is a general question about resources available, I would point to the Paycheck Protection Program. It looks like a deal has been reached, and eligibility for that. Obviously, you have the employment numbers that you have to be under 500. So that's one source of funding. I'm not aware of any other sources of funding for independent living off the top of my head.
Okay. Thank you. It doesn't look like there are any other questions. Elise, did you have anything else you wanted to touch on?
I don't think so. We can compile a list of potential resources available or applicable to IL, but I agree with Corey. I'm not aware of anything outside of what we've already shared.
Right. Okay. All right. Thank you. If there are no other questions, does anyone else have any questions? No? Okay. We will move on to Ann Castro to discuss PPE with the group.
Good afternoon, everyone. I wanted to let you know that for those of you that participated in the community bulk buy, it does look like we have hand sanitizer coming out in, should be shipped. The earliest is going to be the end of this week. Could be a trickle into the following week. I do not have an update on the face masks that were placed with that same order yet, but we should be receiving an update on when those will be shipping in the next day or two. However, I have been focusing most of my time looking for resources that were either in stock or at least stateside, so the lead time would be much shorter. And as of this morning, what I have found sources for I did find some additional masks, gowns, gloves. I did find, thanks to one of our great communities, a resource for hand sanitizer. There is also a source that if you're willing to, or you're close in the San Antonio area, that is offering hand sanitizer on a pickup basis. I also have a really good source for face shields. And what I'm focusing on in addition to that is the shoe covering and disinfectant spray. I've had a couple of communities that have asked for that in the last 24 hours. So I'll be working to secure that, and just make sure you're watching for your PPE alerts that Juliana helps us send out. So any updates we like to post to there. So if you're not getting those, please let me know. And if there are any products that I haven't mentioned or categories that I haven't mentioned, please reach out to me directly. Send me an email or give me a call. And if there's anything else I can do for you with regards to looking for additional sources, just again, please reach out.
All right. Thank you, Ann. Does anyone have any questions for Ann? No. Okay. Last week, George had asked about positive stories. I think this is probably a great time to share those. Does anyone happen to have any positive stories? I know I reached out to Tim Kozik. He had shared with us a very heartwarming story this past week. So Tim, if you wouldn't mind sharing your story, and maybe others can join in.
Sure, Crystal. Can you hear me okay?
Yeah, we can hear you.
Last Friday afternoon, I'd say was probably the most positive and uplifting thing that's happened at our assisted living facility since we locked our doors over 30 days ago. The family members and friends and volunteers of our community, they on their own organized I want to call it, I guess, our first ever and hopefully not annual COVID-19 parade for the residents. And basically they circled our entire building, which is probably about a quarter mile worth of a concrete driveway with their vehicles, while the residents and staff watched from inside the building. They decorated their cars, they wore signs, lots of smiles, lots of tears. And after looking at some of the pictures from the events, I think probably one of the things that hit home for me the most was that this has been real tough on all of us as workers in the industry, but we're not directly experiencing the separation from the loved ones that are in our facilities because we're with them every day. And just seeing that on the faces of our family members as they drove by, it was pretty emotional. But one of the best things about this event was we're so used to having to put a lot of effort into coordinating big events like this. Well, that was the family members and friends and volunteers that took that burden off of us while we're focusing on providing care right now. So it's a very good experience for us.
Thank you, Tim. Does anyone else have anything that they'd like to share, any positive stories?
This is Kathy from James L. West. And I just want to thank our LeadingAge partner organizations, and specifically Buckner. They have been incredibly helpful. And so as we're all in the midst of the storm together, it's an incredible fabric of a community. And I just want to say thank you.
Thank you, Kathy. Anyone else have any stories that they'd like to share? I'd like to open it up for any open discussion, anything that we haven't covered today, or something you would like to discuss with your peers. Don't be shy. Okay, let me check the chat. No? Okay. Well, I do want to remind everyone that this week is Careers in Aging Services Week.
Today's modern seniors.
Oh. Okay. This week is Careers in Aging Services Week, and we have taken to social media to highlight the heroic individuals that are working in aging services. We're also highlighting the LeadingAge Texas and LeadingAge National Job Board this week, as well as we posted some questions about why you work in aging services. So we'd like to encourage everyone to go online and share these positive stories, and in order to encourage careers in aging services. Also next week, we have Melissa Ward and Karen Welsh with Functional Pathways, who will be joining us for a weekly call. They will be talking on how to stay physically and mentally well during the COVID-19 isolation. So that's a topic I think we could all use for sure. Thank you all again for joining us today. Please stay in touch with the LeadingAge Texas staff and each other, and let us know how we can continue to help you. Thank you, everyone, and stay well, and we look forward to hearing from you soon.